Okay, so hello and a warm welcome to everyone joining us today for our Q&A session on PLGA in drug delivery using microfluidic system. My name is Linh Nguyen. I am the marketing assistant for Dolomite Microfluidics, and I will be your moderator for today. Before getting into details of today's topic, I will go over a brief introduction of this session and some housekeeping items. This is the latest Q&A session from Dolomite Microfluidics, specifically designed to address your burning questions about PLGA in drug delivery using microfluidic system. During this session, our expert at Dolomite Microfluidics is ready to provide you with in-depth explanation and real-world examples that shed light on the fascinating world of PLGA in drug delivery. Please note that the GoToWebinar interface we used to podcast today's section has two active components, the viewer window and the control panel. The control panel can be used to submit questions that will be discussed during the session. You can submit questions throughout the presentation. Lastly, I want to note that the session is being recorded and we will send out the recording to you afterwards. Before we jump into the questions, I would like to introduce our speaker today, Dr. Chinh Nguyen, application leader at Dolomite. Currently, he advises Dolomite's customers in the Asia-Pacific region on applications related to microfluidics and nanoparticle formation. Please join me in welcome Dr. Chinh Nguyen. Here's how our session will unfold. We will begin by addressing some of the pre-submitted questions we received through the registration process. Our experts have prepared detailed answers for this question. We will share with you first. After that, we will answer any question that you may have about this topic. So feel free to submit any question in the question panel. Yeah. So, Chinh Nguyen, you can start now.
Thank you, Linh. Thank you, Linh, for the introduction. Hello, everyone. So, thank you for joining today the PLGA Queriosity event. So, I will start with the few questions that we received during the week from the audience, and then, as Linh mentioned, we will have free discussion during the section. So if you have any question right now, just feel free to give your question in the question box or chat box. So we will have more discussion on that one. So let's start with the first section in here. So we will give an answer on the list of the questions that already prepared. So for the first question we received is how to extract the PLGA to calculate the entrapment efficiencies. And we know that when we're studying in drug encapsulation in PLGA, so encapsulation efficiency is also an important factor that the customer needed. So the encapsulation efficiency will be calculated by the weight of the drug in nanoparticles to the total weight of the drug in nanoparticle and weight of the drug in the medium. So basically, there are two methods for determining the drug encapsulation efficiency in nanometer drug delivery system. So the first method, the free drug is separate from nanocarrier and we measure. So the nanoparticles must be dissolved in an organic solvent. For example, like dichromethane, DCM, or dimethyl sulfoxide, DMSO, or acetonitrine, modified acetonitrine, and also NaOH-based extraction can be used to directly calculate the encapsulation efficiency of the loaded drug in PLGA nanoparticle. So the second method is indirect method. So in this case, the free drug and nanocarrier are not separated, and it will be measured indirectly. So the indirect methods will include the bisynchronic assays like BCA method, for example, like with EQ for loaded protein in the PLGA nanoparticle, and fluorescent or radioactive methods also can be applied for indirect methods. So in this question, I will focus on the direct method to show how to extract PLGA, what method to how to extract PLGA in the solvent, and in order to calculation of the encapsulation efficiency. So we will start this case with two case study. The first case study is to calculate encapsulation efficiency in the doxorubicin DOX encapsulation efficiency in PLGA nanoparticle. So basically, when in order to encapsulation efficiency, we need to separate the particle that encapsulates the drug inside and free particles by several methods like filtration or ultrafiltration or centrifugation, and then we dissolve or extract PLGA by using the organic solvent, and then we can measure the amount of the drug that already encapsulated in nanoparticle. So in this case study, so 1 ml of microfluidic solution will be collected from the microfluidic system reservoirs, and then transferred to a beacon ultrafiltration tube to centrifugate for 30 minutes at 8,000 RPM, for example, to separate the drug-loaded nanoparticles. And then the filtered nanoparticle will resuspended and dissolved by an organic solvent like DMSO in this case. So the PLGA will dissolve in the DMSO and release the free drug that encapsulated in PLGA nanoparticles, and then the concentration of the encapsulated drug by PLGA was calculated by just measuring concentration of the drugs in the mixture by just using the UV adsorbent of the solution at the 480 nanometer. It is a wavelength used for measuring of the drug concentration in solution. So it's the first case study. So we can dissolve in DMSO, for example, or DCM for releasing of the encapsulated drug inside the nanoparticle. For case study 2, we will learn more the way to calculate encapsulation efficiency protein in PLGA nanoparticle. So in this case, it can be hydrophilic, the encapsulated drug in PLGA nanoparticle. So for direct method, the nanoparticle, it's the same concept. The nanoparticle must be dissolved in organic solvent in which the protein precipitate and must be dissolved in the proper medium such as buffer, water, or NaOH solution. And this case, the bovine serum albumin BSA used as the motor protein. So we have several organic solvents that select for extract the PLGAs. So the first candidate is dichromethane-based extraction, DCM. So in this case, around 10 milligram of the PLGA nanoparticle loaded with the BSA dissolved in 1 milliliter of the DCM and stirred on the cycle incubator for 30 minutes at 37 degrees C. And then 1 ml of the phosphate buffer saline were added and vigorously was takes to extract BSA. And then the mix centrifuge at 10,000 Z for 5 minutes, and then polymer content supernatant were discussed, and finally the total protein in supernatant were determined by the BCA method according to manufacturer instruction. The blank nanoparticle was spiked with a known amount of BSA for comparisons. And the second candidate for solvent select is acetonitrile for base extraction. So like dichloromethin method. So PLGA nanoparticle would dissolve in acetonitrile and finally extract protein in solution. That were measured by the BCI methods. And so in this case, blank nanoparticle was spiked also with a known amount of BSA for reference. The third candidate can be used. So when candidate can be used is modified acetone nitride by base extraction. So in this case, 10 milligram of PLGA dissolved in 1 ml of acetone nitride and incubated for 30 minutes of the BSA. 30 minutes at the 37 degrees C under continuous stacking. And then 1 ml phosphate the PBS were added and slowly extract the BSA. So the suspension was centrifuged for 5 minutes, and the polymer content the supernatant were discussed as well. So the pellet content the BSA were dissolved in sodium hydroxide 0.1, and then the solution were neutralized by 1 ml of HCl, and protein were measured by BCA methods like in previous. And then for validation, the blank nanoparticle also was spiked with a known amount of the BSA. And the other also can be used for PLGA extraction is NaOH-based extraction. So in this case, 1 ml NaOH and add to 10 milligram of PLGA nanoparticle, sonicated for 15 minutes and incubated at the 37 degrees C for 18 hours under continuous stacking. And after neutralization with the HCl, the mixture was centrifugated at 10,000 Z for 5 minutes, and then the supernatant were analyzed by BCA methods. Also, for validation, blank nanoparticle was spiked with a known amount of BSA. So this is the way that we can use for PLGA extraction in order to encapsulation efficiency. So it depending on what type of the drug that encapsulates in PLGA. So we are able to select the right solvent for PLGA extraction and also measure the drug concentration that be encapsulated inside PLGA after removing the free drug by centrifugation or filtration. Okay, so move to question 2. What are possible membrane material for hydrophobic drug encapsulated PLGA nanoparticle releasing assay? So regenerated cellulose is currently used. Yeah, it's also very close to step with the question 1. So it relates to encapsulation efficiency calculation. Also, it's used for a drug release study. So basically, dialysis membrane method is one method for for studying of the drug release process. So it requires you for an versatile method for testing and in vitro drug release of the particulate formulation. So in this method, utilize an approach dialysis membrane with a specific molecule weight cutoff to physical separate the release drug molecule from microparticle by allowing drug pass easily through the membrane into the release medium. So in this case, this method has been performed in the clipped back dialysis tubing or various type of dialyzers, and commonly regenerated cellular membrane are used for this study. For example, one example is ultrafiltration is used to concentrate the drug encapsulation in PLGA nanoparticle. So, and then the concentrated nanoparticle solution then transfer into dialysis membrane. That's again the 40 milliliter per solution in condition. And the most common used dialyzers can be used float analyzer. It's from Spectrum Laboratory, or pure analyzer Sigma Drake, or D2 with from Merck and Medipol, and GBA flex dialysis tube, Gene Bio application. So all of the listed dialyzers using the regenerated cellular membrane. Also, the analyzer dialysis cathode with 10K molecule weight can be also used for this study. So in my experience, we mostly researcher and customer using regenerated cellular membrane for hydrophobic drug encapsulated PLGA nanoparticle releasing study. With other membrane we use, but we not really expert on that. So we just list the candidates that commonly used in the world for this study. So most product, almost a product that's listed using the regenerated cellular membrane for dialysis process. So move to question 3 that we received is what are the key challenges in scaling up PLGA-based microfluidic system for larger scale drug production? It's a very good question, as we know that microfluidic technology has been offers powerful platform to control the size distribution, just safe and rapid processing and uploading drug with varying the hydrophobicity and properties. So although the technology provides wide range of opportunity, so it's not free from limitation and drawbacks that can hinder its application in larger scale. For example, the first important issue that should be addressed by proplastic researcher is the falling of the PLGA nanoparticle during the precipitation process and blocking the microsite channel and getting the chip blocking. As a matter of the fact that microfluidic production of PLGA drug delivery system is considered so as a continuous process, which avoid back-to-back variation. This feature has been arguably accepted as one of the successful aspects of the technology. However, scientists are struggling with the huge number of further chips in the lab due to the clogging of the micro channel. So in Dolomite, we have three Dolomite 3 pore junction that can eliminate this problem just by avoiding droplet contact with the sidewall. So in here, it's a chip junction design with 3-pore structure, so it can prevent the precipitation or deposition of the PLGA nanoparticle or PLGA material in the sidewall, and then it can avoid the droplet contact or the polymer contact with the sidewall of the chip, and then it can increase the lifetime in use of the microfluidic chip. The second issue challenging is not only falling nanoparticle, but also problem are being reported related to wettability and hydrophobicity issue in microparticle production. And also one challenging is manipulation of small volume liquid in microsize. It had been mentioned as an advantage of the apparatus. However, it is a double-edged sword and could be disadvantage at the same time. Like low volume of liquid can cause a low throughput of the fabrication process that cannot meet in the industrial and larger scale production demand. So despite all attempt done to solve the problem, so results are not admissible and show that microfluidic hardware choice needs to be selected according every synthesis process. So although there are few reports of high production rate suitable for preclinical and clinical demand, researchers need to search a solution for this very crucial issue. So future microfluidics should be able to produce high amount of drug without sacrificing accuracy and efficiency. Okay, so that's the 3 questions that we had been received during the weeks, and now we move to the free discussion with the question from you. If you have any question, feel free to leave question in the question box chat box. You can answer. Okay, I have one question from Bayang Hu. Okay. Okay. Thank you for the answer. Also, what would be any reason if only a very small amount of drug is released out during the releasing assay with experiment setup seem fine? Yeah, so based on our experience, so small amount of drug is released out during the releasing assay depending on the process that you use. For example, like you select the right molecule weight for membrane, the dialysis membrane that used. Also the time for incubating the drug during the dialysis process also we decide to small amount of the drug beside the amount of drug that is released out. So also the drug release during the time also depending on the particle size, also the pore structure of the particle. So if you choose the right condition to get the right particle size, you can achieve with different amount of drug that's released during the analysis process. So I think yes, I think the amount drug release, if you decide that the method you are using is correct way. So it's one method for just in vitro study, but we also have the other methods like in vivo method for studying the drug really and effective drug really kinetic uh, uh, for the application. So a big factor that can affect on that one. I would suggest that you can try with different with at a different factor that can affect on the result and compare to optimize the condition as well as the optimize the time for studying for doing this experimental setup. The second question, yeah. We also suspect that maybe the membrane would somehow absorb the nanoparticle and so blocking them from releasing. Would that be a reason? It would be a reason. So that's why we need to choose the right membrane molecule weight, like membrane pore size, to prevent that kind of releasing a particle as well as the blocking of the particle. So it depending on the what size of the particle, you can choose the right membrane size, the pore size, or the molecule weight value. Yes, and also basically the membrane size one factor, but another factor also it directly affects on drug release kinetic study. So it would be related to, as I mentioned, it relates to the particle size and also related to your structure, the particle structure like pore structure. So it will affect on the amount the regions affect on the regions. Okay, I hope that answer is helpful for you. Do you have any more questions? Okay, do you have any more questions?
Can you guys hear me?
Okay, hi, I can hear you right now. Okay.
Hello.
Hello.
Sorry, I was the person who asked that question.
Okay.
So, thank you for your answer first. Um, I think you've answered some part of it, but then I want to be more specific about that question. So, you mentioned about the pore size and then the particle structure. You relate to them. And then that affects how the particle release the drug, right? But then I wanted to ask if you have any possible solutions. If you could also check our experimental settings, I think that can help you to answer our question more specifically.
Okay.
But then I'm not sure if you're available right now, because I think it's more complicated. If you want me to draw an email to you or anything.
Okay. Yes. So I think in this case, it's better if you can email to me, and then we can arrange another meeting, one-to-one meeting, and we
Okay.
can have we can have further discussion on that one.
Okay, yes, for sure.
Yeah.
All right.
Okay.
Thank you.
Okay. You're welcome.
Okay, thanks. I'll just leave, right?
Okay. Yes. Thank you.
Okay, so if there are no more questions, I'd like to conclude this section for today. Thank you, Dr. Qing Yuan, for sharing his valuable insights on PLGA particles, and thank you everyone for tuning in and actively participating in today's session. We hope it has been informative and enjoyable for you. You will also have access to the recording and presentation after this web session. Please stay tuned for the upcoming events of Dolomite Microfluidics. And if you have a question that remain unanswered, please get in touch with our team. Goodbye.
Bye.